Welcome to Medu. Our today's topic is lung volumes and capacities. So why do we need lung volumes and capacities? So for that, first we will learn pulmonary function test. Pulmonary function test is also called as lung function test. Now what is lung function test or pulmonary function test? It is basically useful in assessing the functional status of respiratory system. As the name itself suggests, it is used to assess the functional status of respiratory system. This pulmonary function test is based on lung volumes, and so this is the reason why we are studying lung volumes and capacities. So it is based on lung volumes. There are two types of pulmonary function test, the static one and the dynamic one. The static one is time independent. It is basically the volume of air inspired or expired. Inspired or expired. The dynamic pulmonary function test is basically time dependent. That is, it is the rate of inspiration or expiration. Now we will come to our main topic, and that is lung volumes. So there are four types of lung volumes. The first one is tidal volume. The second one IRV, which is inspiratory reserve volume. The third one is ERV, that is expiratory reserve volume, and the last one is the residual volume. Now what is tidal volume or TV? It is basically the volume of air inspired or expired in quiet breathing. It is basically normal depth of the breathing. So you can define it as volume of air inspired or expired in quiet breathing. So the normal value of tidal volume is 500 ml. Now second one is the inspiratory reserve volume. Inspiratory reserve volume is the volume of the air that could be inspired by forceful inspiration by using accessory muscle. It is basically the volume which could be inspired after tidal volume. Generally we require inspired reserve volume in strenuous exercises. We can define it as the volume that could be inspired forcefully. The normal value of IRV is 3300 ml. Now let's come to ERV. ERV is expiratory reserve volume, and it is the air that could be expired by forceful expiration by using accessory expiratory muscles. It is the volume that is expired by forceful expiration. It is the additional volume that could be expired after tidal volume. So the value of ERV is 1000 ml. Now let's come to the residual volume. The residual volume is the volume of air which is remaining in the lungs after normal inspiration or expiration. Residual volume is the volume of air that remains in the lungs. The normal value of residual volume is 1200 ml. This is the volume which is remaining in the lungs after forceful expiration. Now, why there is the need of air being always present in the lungs? So the reasons of residual volume is significant because the first reason is it helps to aerate the blood between breathing and expiration. Aeration between breathing and expiration. That is when there is no inspiration and there is no O2 present, the residual volume helps in aeration of the blood. The second reason of residual volume is it maintains the outer shape of the lungs. It is responsible for non-collapsible behavior of the lungs. So we have a graph to explain all the volumes. This is tidal volume. Tidal volume is the volume that could be inspired or expired in quiet breathing. This is inspiratory reserve volume. Why this is called as inspiratory reserve volume? Because this is the volume of air which could be inspired forcefully after tidal volume. And this is expiratory reserve volume that could be expired forcefully after tidal volume. And the last volume that we studied was residual volume. Residual volume is the volume that always remains in the lungs. The two reasons why it always remains in the lungs are the aeration and maintenance of outer shape of the lungs. Now it's the time to study the capacity of the lungs. So there are 4 lung capacities. The first one being IC, that is inspiratory capacity. The second one is VC, that is vital capacity. The third one is FRC, that is functional residual capacity. And the last one is TLC, that is total lung capacity. The first one, IC. First of all, I would like to share the formula so that it would be easy to define them. So the IC is equal to TV plus IRV. Lung capacities are nothing but just the sum total of the lung volumes. So inspiratory capacity is the sum total of tidal volume and the inspiratory reserve volume. Inspiratory capacity now could be defined as the maximum volume that could be inspired after normal expiration. As we know, after normal expiration, the volume of air expired is called as tidal volume. So what could be the inspiratory capacity? It is the maximum volume inspired. So it includes tidal volume plus inspiratory reserve volume. This becomes inspiratory capacity. Now the second one is vital capacity. Vital capacity is equal to IRV, that is inspiratory reserve volume, plus tidal volume plus expiratory reserve volume. Now how can we define vital capacity? It is the maximum amount of air that could be expired after deep inspiration. In deep inspiration, we inspire tidal volume plus expiratory reserve volume. Now we have to expire forcefully, and so it includes expiratory reserve volume. So vital capacity can be defined as the maximum amount. It is the maximum amount that could be expired. After forceful inspiration. Functional residual capacity is ERV, that is expiratory reserve volume plus residual volume. This is the volume of the lungs after normal expiration. As we know, we release tidal volume in normal expiration. Then what is the remaining volume in lungs after normal expiration is expiratory reserve volume and the residual volume. So this is the remaining volume of the lung after normal expiration, which is called as FRC, that is functional residual capacity. The last is TLC, that is total lung capacity. So TLC is equal to IRV plus TB plus ERV plus RV. It basically includes all the volumes of the lung, and it is defined as volume of lungs after forceful inspiration. Now we will determine the values of all the capacities. The inspiratory capacity is tidal volume plus inspiratory reserve volume, which is equal to 500 plus 3300 ml. The vital capacity is IRV plus TV plus ERV, which is 3300 plus 500 plus 1000 ml. The functional residual capacity is ERV plus RV, that is 1000 plus 1200 ml. And the TLC is the total lung capacity, which is equal to 3300 plus 500, ERV which is 1000, and the residual volume which is 1200 ml. Now looking to the graph again. So we'll revise all the volumes and capacities. Tidal volume is the normal volume of the air which could be inspired or expired. Inspiratory reserve volume is basically the volume of air which could be inspired forcefully. ERV is the volume that could be expired forcefully. When we talk about residual volume, it is the volume of the lungs that is remaining in the lungs after normal expiration. After normal expiration, we release tidal volume, and hence residual volume always remain in the lungs. Inspiratory capacity includes both inspiratory reserve volume and tidal volume. It is basically the volume of the maximum volume that could be inspired after normal expiration. The vital capacity includes IRV plus TV plus ERV, that is the maximum amount that could be expired after forceful inspiration. Functional residual capacity is the volume that is remaining in the lungs after normal expiration, which is equal to ERV plus RV, and the total lung capacity is the volume of air that is present in the lungs after forceful inspiration. Now basic points we are going to study are spirometry. Spirometry is the method to measure lung volumes and capacities. Method to measure lung volumes and capacities. And the second one is the spirogram. Spirogram is the graphical record of lung volumes and capacities. Lung volumes and capacities. Here we end our topic. Thank you.